This out of the way. I'm sure we'll have a couple more people trickle in. We'll just make them go around. So everybody has a green sheet?
Yes.
A pen? Anybody else? I don't have any up here, but we'll make sure you get one. So I'll be going through the sheet pretty much exactly as it is. My name is Chad Madden. I'm the founder of Madden Physical Therapy here. And originally it was over on Prince Street. Remember that by El Rodeo? And then 6 years ago we moved over here. Let's go!
Look, I was here before any of you were.
All right.
She had to run an errand.
Okay.
No, I didn't have to go. I didn't see anybody there. Okay.
Before we go any further, you have your green sheet. Everyone need. Okay, great. All right, I'm gonna go away now. Bye bye.
Oh, I can't see that.
You can't see the board?
I can't see what's so light.
Okay, well, here, you can come up here and sit closer.
Okay. Yeah, that's better.
Better?
Yeah. I was here early. Nobody else was around.
Okay, is that better?
That's better.
All right. So, just out of curiosity, how many people within the last 30 days have had back pain or sciatica? All right. How many people are in denial? Okay, just making sure. So today what we're going to talk about is back pain and sciatica, and the big thing that we'll cover is the 3 common causes of each. And so with the sciatica, and this is going right down your sheet. So sciatica, the sciatic nerve is the largest nerve in the body. And then it's actually 2 nerves that start in the back. It travels down the back of through the buttocks, down the back of the leg, and then behind the knee it splits into the 2 nerves. And they go down into your calf, your shin, and even into your foot and your toes. Okay, so for the people that raised their hand, which was pretty much everybody, what type of activities give you trouble? Walking? All right. Walking, standing, sitting, sleeping? Okay. Okay, but walking bothers you? Okay, all right. So when we get into the causes here, you're going to see that the thing that we look for is that if the sciatica and if the back pain, if it's reproducible. So we'll get there in a second. So on 1C,
Green paper.
yep. You need a pen? No, yep.
No, I have
Anybody else need a green paper?
a pen. You didn't give me one.
I'm just seeing if anybody else needed one while I was grabbing one. Okay, so when people get sciatica, you can picture it like a garden hose. So how can a problem in the back cause pain, numbness, tingling, or heaviness into the foot? Well, if you pinch like one end of a garden hose, do you ever see like where you get like a kink in the hose and then the flow stops and you have to go back and take the pressure or unwind the kink? It's the same exact thing with your sciatica. So for people that we see that are getting pain, numbness, and tingling down their leg, a good physical therapist just goes through and says, okay, this is where we're getting the pressure, let's relieve the pressure, and then everything goes back to normal. All right, so 1C there on your sheet is pain, numbness, tingling, and some people also will experience heaviness. And I guess who am I? So, why do I get to stand up here and talk about back pain and sciatica? The first thing that we'll talk about here is how I came to specialize in it. So when I came out of school, I graduated from locally here from Central Dauphin. Then I went to College Misericordia, and I specialized in back pain studies. And what I did when I came out, I worked for a local back surgical group. I saw a ton of surgeries. And we would also see people before surgery trying to save them from surgery. And really quick, what I did was I applied exactly what I learned in school, and like 25% of people So 25%, they were really happy. They thought I was amazing, just from the treatment. And they would do really well, they would avoid surgery, and they would go about their way. And then 50%, most people, they were okay. So maybe I'm better, maybe they just like coming to physical therapy, but they weren't necessarily better, they weren't getting any worse. And then the other 25%, we actually aggravated. So I didn't do well at all. And I did that for about 2 years, and I got really, really frustrated. And so this is using like the classic physical therapy that I learned in PT school. So what happened is one day I went home. My wife was pregnant with our second son, and she had knelt down into the laundry room and was working in the washer and dryer and was pulling clothes out of the washer to transfer them over, and she was stuck. And she was there for an hour and a half before I got home. So she was crying, really, really, not a good situation. We were early in our marriage, pregnant with our second son. She was really, really upset. And I said, well, are you doing the exercises that I told you to do? And she was like, listen. And the crying stopped for a second, and she got really angry. And she said, I'm doing everything that you're telling me to do, and I do it every day. What you're telling me to do isn't helping. You're a physical therapist. Figure it out. So I did. And we're still married. We ended up having 4 boys, and then we just had a little girl recently. So we have a lot of kids. But anyhow, what I did was I ended up studying and looking into the research about how to treat back pain and sciatica. And I found a couple really good researchers. And then what I did then was I just made a vow that I would never do anything that wasn't supported by research. And we came up with a really successful treatment technique, and it's you'll see this a little bit later on, but it's actually a European-style physical therapy. So we'll talk about that more here in a second. And by the way, when I started doing it, we very much butted heads with other local physical therapists. But I remember the first day that I went back when I started treating with this style, I had a couple people in who I'd been seeing for 3 and 4 weeks, and they were over here, they were okay, really weren't agitated, but they weren't miraculously better or anything like that. And I remember one person in particular had been there for 3 weeks. I took a look at what was going on, and I did this hands-on technique, hands-on physical therapy, and it was instant. And they stood up and they were like, "Oh my gosh, what did you do? That was the best thing ever." And it was I was sold from there on out. So we converted now a lot more than 25% of the people that we see. It's closer to 90% do really well with PT. All right. So we'll talk about that as well. And I want to give you some tools here. Along the way, about 5 years ago, I started making little YouTube videos, oddly enough, in this room, and just started posting them online. And I was answering questions of people that I would see in the clinic, the most common questions for people with back pain and sciatica. And they kind of went viral. So right now we have, I'm about 7 million views, and I have 16,000 subscribers all over the world. I've treated people internationally. We've had people in the last year fly in from Colorado, drive up from Virginia, New York City, Philly, Pittsburgh, Baltimore, D.C. We have an executive flying up from Kentucky just for treatment. Pretty crazy. And we're right here in Harrisburg. So right now on there, I think it's on your sheet, I'm the #1 most watched back pain and sciatica specialist in the world. And we get questions from everywhere. It's pretty neat. The Patriot News even did a couple stories on us. One was a gentleman that I treated in India, and when we talk about herniated discs here in a second, I'll share his story. But it was a pretty unique case where in India they have people that have crazy wealth. Like he has a Porsche, but he's surrounded by 20 miles of dirt road, so he can't drive anywhere for PT. I don't understand why he has the car, but he does. So, and he had a really good story, so I'll share that in a second. The Patriot News picked it up, and they actually did a nice piece on it a couple years back. So we'll talk about that here in a second as well. Also, many of you have the copy. So we ran out of the hard copy of the book. We had 2,000 originally published, but it's called Pain-Free Motion for Your Lower Back. And that came from just doing these workshops that I've been doing for the last 8 or 9 years, talking about this type of therapy. And then we had people request, hey, can you write this down? So I ended up writing it down, and then there's something in there to take with you. So we'll have time today in our hour together to go through 2 or 3 of the main concepts. But there's a little bit more material in there for you as well. And then, did everybody get a copy of the top 10 burning questions for sciatica? All right, pass it around. One more thing, right? So I just want to tell you how this report came to be, and then we'll move on to some good stuff here. So if you search sciatica online, you Google it or you go to YouTube, one of my videos will come up right away. And we surveyed 3,100 back pain and sciatica sufferers all over the world, and these were the 10 most common questions. And then I just went through and answered them for people both here in the U.S. and also internationally. So let's move on to number 3 there. Enough about me. So the first step, when we're looking at back pain and sciatica, is the pain reproducible? So I heard standing, and what we look for, the first thing that we look for as physical therapists, as PTs, is can we reproduce your pain? So is there something that bothers you every time that you do it? So standing, walking, sleeping, sitting. How many people have trouble with yard work? Good. You don't do it?
No.
All right.
I did that for almost 53 years.
53 years?
I gave it up.
All right. Slacker. I'm just teasing.
No,
That's a long
it's
time.
okay. That's
How
okay.
about housework, like running a vacuum cleaner? Does that bother anybody?
Yes.
Housework. What about lifting? Can you lift something up? Lifting. How about getting dressed?
Yes.
Anybody have trouble with that? Okay, we'll see a lot of people that'll have trouble, like they can put one sock on okay, but they go to do the other side and they have to
Yeah.
kind of help it up and over. How about rolling over in bed or getting in and out of bed?
Getting in and out of the car.
That was my next one. In and out of the car. Okay. What about running? Anything else that you can think of? Okay, so there's a little trick. But what we look for, if the pain is reproducible, then usually there's a cause. Okay, so when we see somebody in day 1, we can't really change their pain at all, and it's just like a constant 4 or 5 out of 10 ache, and it doesn't matter what we do, the pain just stays the same. That's a huge red flag for us, and that's the type of person that physical therapy isn't going to help. Okay, if one of these bothers you, there's a really good chance that there's a cause that we'll talk about here in a second, and there's usually hope for you, because if the pain's reproducible, then it's usually, oh, I erased the D. It's usually reducible, because we can go and address the cause of the problem. All right, so we're going to do, I'll put myself on the spot here. Everybody can stand up. Bend forward. Touch your toes or in that general direction. Okay, and back up. And then bend back as far as you can. All right. Anybody have pain bending forward? Don't fall. You're not allowed to fall. You okay? A couple people. How about pain bending backwards?
Yes.
Yeah.
Pretty much everybody? All right. So next one, you're going to bend down to the left. Your left is over here. And then down to the right. Does anybody feel a difference side to side?
Yes.
So one side is easy to bend to, the other way is easy?
Yeah.
All right. Does anybody want to volunteer? So for the people that it's easier to bend one way, does anybody want to volunteer? I'm going to treat you right now. Come on over.
Oh.
Yikes.
And it was Carol?
Yeah.
All right, let's have a hand for Carol, everybody. All right, you can sit down. Here, let's get rid of this. Have you ever had physical therapy before? Oh, sure. Was it with us?
No.
Oh, great. All right. So day to day, what do you have the most trouble with? So like if you had to pick an activity, what bothers you the most?
One thing, sitting probably is more.
Okay, so if you sit for long periods of time?
Yeah.
And where do you feel it at? Right there?
Yep.
Okay.
Goes down.
How far down your leg does it go?
Sometimes to my heel. Most
Okay.
of the time maybe just to the calf.
Okay, so it starts right here and it goes down. Is it a shooting pain? Or is it an ache, numbness, tingling? What do you feel?
Tingling and sharp pain.
Okay. How long has that been going on for?
Long time.
Years?
Yeah.
Okay. And has anything helped it?
I had 2 back surgeries, laminectomies. That alleviated a lot of the pain.
Okay, so it gave you like a temporary relief,
Yeah.
at least with the edge
After
off.
my second surgery, I noticed more numbness
Okay,
and tingling. Like I can't, if I sit on the floor, I can sit in a chair, I can sit here. If I sit on the floor,
Yeah.
my leg will go numb.
okay. All right, so other than sitting, what else bothers you?
Running, because I run a little bit, and after I run, then it'll be.
Okay. All right. Longer than 5 years?
Yes.
10 years?
Yeah.
Oh.
About 15 years.
Wow, this is going to be a challenge. All right. So let's have you move here for everybody, Karen. You're going to stand right there. Yep, face that direction. Bend forward, touch your toes, and back up. Any pain, numbness, tingling with that? Okay. Bend back as far as you can, and back up. Grabs you right there. Does anybody know what that is? Sciatic. All right. So in central Pennsylvania, everybody calls that their sciatic. Okay? It's actually called the Sacroiliac Joint. It's the joint between the tailbone and the hip bone. And when we talk about, it's a really common problem. It's often overlooked because it doesn't show up well on x-rays or MRIs if there's a problem there. And we'll talk about why it's the most missed problem that we see. But yeah, it's called the Sacroiliac Joint. Everybody in central Pennsylvania says, my sciatic is really acting up today. The true sciatica will travel down the back of the leg. All right? You can face everybody here, Carol. And then bend down to the right.
To the right.
And then,
That pulls the same spot.
okay, and then down to the left. Any,
Just tight.
okay, raise your right knee up to waist height, like you're marching in place. And back down. Left knee. Back down. Any difference there side to side? Wonderful. You can lay on your back here. And we've never met before. We're not related or anything like that. I've had somebody say yes already. I just didn't know we were related. Keep your leg straight. Raise it up this high and back down. Just do that 5 times. That looks easy. Switch your legs. And same thing over here. Yeah. Any difference between the right leg and the left leg?
No, it just feels a little bit tighter maybe, because that's the side that hurts.
Tighter on the left?
Yeah.
Okay, fair enough. I'm just going to go through a couple simple tests here. Pain with that in your back? Just tightness here?
Yeah, just tightness in the hamstrings and calf.
So if I go like that, anything in the back?
Just tightness.
Okay. When was your last laminectomy?
2003.
Oh, so you're 12 years out.
Mhm.
Okay, cool. Relax. Let your leg go limp. Pain with that?
Mhm.
Relief? Or just
It
neutral?
feels comfortable.
Feels comfortable?
Mhm.
Okay. Anything there?
Mhm.
Good. Anything there?
Mhm.
Pretty good. All right. I'm going to move you around.
Okay.
Okay, you're going to lay on your right side. All right. This won't be the best view for you, but we'll flip around and do the other side too so you can see what I'm doing. Just slide towards me here. All right. So right now what we're going to do is we're going to go to the sciatic, the sacroiliac joint, and I'm just going to move it around and see if that changes anything. We're going to move both sides too. All right. Over here, hold.
You want me to hold against you?
Yep, you got it. And again. And again. Good. And relax. Hold right here. Push in. And again. And again. Good. All right, hold right here. Hold. Hold again. Hold again. And relax. Roll over to your left side. All right. So you're right about there?
Yep.
Okay. So this is pretty light. That's the table cracking.
Yeah, it feels comfortable. It doesn't hurt.
Hold right here. Hold.
Yep.
Did you ever have this done before?
No, not this. Nope. And I've
again.
had a lot of therapy.
And relax. Hold here. Push into me. And again, and breathe. And one more time. Good. Hold right here. Hold. And again. And one more time here. Good. All over to your back. Push your knees apart. Squeeze together. Good. Straighten the left leg down. Just raise it up in the air. See if it's still tight.
Feels a lot better.
Get out of here. Alright, okay. I want you to stand up. And was the worst movement bending back or bending down to the right?
Bending back was the worst.
Okay, let's try that right now. Just see where you're
It's better. Like it moved down instead of right there. It just stretches down, like pulling into the hamstring.
Okay, yeah.
Better.
You look like Mary Lou Retton now.
That was good. It was very comfortable too.
Yep, so in a second here I'll explain exactly what we're doing. But yeah, just moving the pelvis. Very, very simple and easy to do. So let's have a hand for Carol. Thanks, Carol.
Thank you.
All right. So the big thing here that we want to do is we want to address the cause. So let's get into that. And just let me make sure. Yeah, so for number 3, it's is the pain, numbness, or tingling reproducible? And then 3A, if so, then it's likely reducible. So when there's a cause and we want to address the cause of the problem, 3 things we can do. Number one, what most people do, and it's the biggest mistake that we make with back pain and sciatica, is we ignore it. And often, like, we don't think we're ignoring it, but we'll say, like, funny things, and I've done this myself. So do you know who makes the worst physical therapy patient?
Physical therapist.
A physical therapist, yeah. We don't listen to our own advice. So doctors also horrible, nurses that we treat, usually doesn't go well at all. So, and what ignoring will sound like is an excuse. So it might be, you know, my mom had a bad back, I have a bad back. Or I've always had this, it's old age, it's the weather. There's a lot of other things that we can do to really ignore it, and we're just making up excuses. The second thing that we can do is we can try to alter it. And the common example I'll use is, you know, if there was a smoke alarm in the room right now that went off, and I said, just cover your ears, it'll go away. Like, the only thing you're doing, you know, you're not changing anything with the smoke or the fire, you're just covering your ears and changing what you're hearing. You can do that same exact thing with back pain and sciatica. You can take medications, like a pain medication, that does very little. There's no doctor in the world or no physical therapist in the world that would say, hey, taking pain medication is the way to handle the cause of your pain. All right? So you can try to alter it or change it. And the third thing that you can do is you can actually handle it. It is really hot in this room.
Mm-hmm.
1 second.
It was hotter up there.
All right, so I said it to Eric, just kicked on. Sorry about that. Wow. Okay, so when the room that I used to do these presentations in over in Prince Street, we had a leak in the middle of the roof. Actually, there's a really small one right here. So you can see the discoloration in the tile. So what happened is one day we came in, and it's a flat roof over there. And if you've ever had a leak in a flat roof, they're really tough to find. So we had this leak. We came in the one day, and we just kind of let it go. So we ignored it. Hey, it's a flat roof. It's tough to find a leak. We'll just let it go. So we ignored it. And then what happened is the one Monday morning I came in, and the tile was actually sagging because we had a lot of rain over the weekend, and it got really, really wet and was going to collapse. So what we did is we called a roofing company, and we had them come out, and they did this full inspection on the entire roof. And they said, clean bill of health, nothing wrong with your roof at all. It's coming from the HVAC, the air conditioning unit on top. We called the air conditioning company. They came out. They did a full inspection. They said, listen, there's nothing wrong here at all. It's a roofing problem. I was like, we already had a roofer out. So we called a second roofing company. They came out, they did a full inspection. Couldn't find any leaks. They said it's an HVAC problem. I said, I'm not calling the HVAC company anymore because I know these guys and I trust them. I hope I can trust you as the roofing company. So we called a third roofing company. They brought a 500-gallon tank of water, flooded the roof of our building. No leak. So we were like, what is going on here? And so what I did is for years we would just ignore it. And then anytime it would get really bad and the tile was actually sagging from the weight of the water, we just found a case of the ceiling tiles and we would change it out. So it's kind of like pain medication. Like we weren't really fixing the leak. We weren't fixing the problem. But what was happening is we would just change out the tile and it would look okay until the next time it would rain really hard and be windy at the same time. So as many of you know, we do a yearly fundraiser where we take the treadmill of our clinic and put it on the roof of our building. And we've done it. This year was just the 10th year. We started it over on Prince Street. Now do it here, and we raise money for abused children here in central Pennsylvania. We raised over $300,000 in the last 10 years for abused kids. So the one year, Brian was the inspector's name. I'll never forget that because he actually found the leak. But he was doing a roof inspection after we did the run on the roof, and he stuck his finger. So like everybody was looking for the leak on like a horizontal surface, a flat surface, and he went like this. Stuck his finger right in the leak where the cause of the leak was. Pulled me out of the clinic, took me up on the roof. He said, here's your problem right here. We're going to patch this up. You're not going to have a leak anymore. It was 35 feet away from our discolored tile. So it was the whole way in the back of the clinic, or the back of the roof, in the back of the building. They fixed the leak. No more ceiling tile problems. Okay? So it's the same exact thing here. You can ignore it. You can try to alter or change your back pain and sciatica, or you can handle it. Okay? And in order for you to handle it, you have to know some of the common causes of back pain and sciatica. So let's get started on that. How many people in the room are going to have more than 50 birthday candles on their next birthday cake? All right. One outlier. That's all right. So the first thing that we're going to talk about is herniated discs. And in our area, a lot of people will call these slip discs, okay? And if you took 100 people off of the street that had no back pain at all, and you gave them all an MRI, what percent, and none of them had back pain or sciatica, what percentage of them would have a herniated disc or bulging disc on an MRI? Yeah. Any age? 80. 80%. The problem is that so people can have a herniated disc on an MRI and be absolutely pain-free. There's a very bad relationship between what we see on an X-ray or MRI. Now, the exception would be like if somebody has a tumor or they have a fracture or something like that. There's if you have a fracture on an MRI, you're likely in a lot of pain. But if you had, again, 100 people without pain, you gave them all MRIs, or, off the street, 80% of people would have a disc herniation or a bulging disc. So it's really, really common. The next thing to realize is it normally affects people that are 35 years of age or younger. Okay? So usually by the time we're 50 or older, that issue as a problem usually goes away. And we'll talk about disc degeneration here in a little bit, which is for people that have pain with standing and walking, they usually have that cause, not this. Okay? So we'll see 70-year-olds that come in and they'll say, I have a bulging disc. And we'll say, okay, so bend forward, touch your toes. Oh, I can do that, no problem. Well, guess what? That disc is not giving them any problem at all. So it might show up on the MRI, but it's not the real cause of their pain. Okay? So 80% of people have them, 35 years of older, and this is how it works. Okay, so what's this? Vertebrae. All right. Who said that? Nice. So this is bone, and this is bone. And this would be like looking at me from the side. Obviously, the bones in my back aren't this big. This isn't drawn to scale, but my stomach would be up here, and my back is here. So if this is bone, and the most common level for disc herniation is L4, L5. And then right underneath L5 is the tailbone. Okay, so if this is bone and this is bone, what's this right here? Disc, nice. So your disc is in here. And then what's back here? Spinal cord, right. So this is nerve, and then this is like the tree trunk, and then these are the branches coming out. And when we see somebody that has a problem with their disc, what will happen is this disc will begin pushing out the back and hit the nerve. So this person, when they bend forward, they wedge the disc out the back, and it gives trouble right there. Okay? So this person usually has pain with lifting. They've usually had some sort of trauma. Again, 35 years of age or younger. Some sort of trauma, or like we'll see a lot of drywallers or painters that are constantly doing this. You know, they're just constantly bending over and over and over again. Okay. And successful treatment for this is just getting all that material to go back. So if somebody has a herniated disc on an MRI, can you heal the herniated disc? You can? How many people say yes? Herniated disc on an MRI, can you heal the herniated disc? Meaning you go back in, you have another MRI, and there's no more herniation. Yeah, you can relieve the pain, but you can't heal it. Yeah, this is odd, you actually can. Okay, so you can actually, so if the disc is herniated, and it's even popping through, you can heal that. And there's 4 levels of this. I know it doesn't affect too many people in here, but it's you should just realize the healing capabilities of your body. The lowest level is a bulging disc. Above that is a herniation. Above that is actually a rupture. Okay, so very rare. Through here we've had over 6,000 back pain and sciatica sufferers. We've probably seen 3 ruptures in all that time. It's very rare. Usually this is like falling off a 2-story building, high-speed car accident, something like that. We had a guy that he was in a 5.5-foot ditch and the soil collapsed on him, ruptured disc. And there's actually a level beyond that, and it's called a sequestered disc. And I've seen one in my life. The guy, he was a rodeo clown, and he got hit. He did not have surgery. He did not have any injections. And you could actually see before and after on the MRI that he completely healed. His secret, he was 24 years old. So he had, we can't really change that. Okay, I can't really make you 18 again. But just realize that for most people, they can heal. That guy in India that I was talking about, he was early, mid-30s. I think he was 33 at the time we started working. He went out and had an MRI, showed 3 levels of disc herniation on his MRI. I treated him over a webcam like this. We found, and this is so weird, we found a therapist in India that was trained by the same therapist that I was trained by here in the States. I don't know how that happened, but she was in Bombay. So he actually flew to Bombay for the hands-on PT that we did here. And then he flew back, and then once a month we would get on. I would check his progress, see where he was at, and we would fine-tune his exercise program because I couldn't do the hands-on because I wasn't there. 8,000 miles away from Harrisburg to Calcutta. So I treated him that way, and then what happened was 18 months later, he got another MRI, complete healing of those 3 levels. No herniation at all, okay? So, and we surveyed doctors in our area. 73% of physicians in central Pennsylvania recognize that you can heal a herniated disc without surgery or an injection. Any questions on disc herniation? All right. Next cause is arthritis. How many people have heard of arthritis? Arthritis, stenosis. How many people have stenosis on an X-ray or MRI? Stenosis, or sometimes it will be abbreviated like this, degenerative disc disease. But just realize they work all the same way. All right? So 50 years of age or older. This was the 50 or more birthday candles on your next cake. 50 years of age or older, pain with standing and walking. That goes away when you sit down. If you have those 3 things going on, so how many people in the room are 50 years of age or older, have pain with standing and walking, and their pain goes away when they sit down? 99% chance this is the cause of your pain. Really, really high. Okay, and how it works is this. So we've all seen somebody with stenosis. Have you ever been in Giant, Carnes, Weiss, Wegmans, walking through and you see somebody going like this on the cart where they need the cart, or a friend that says, I just need to sit down for a minute? They have this going on, okay? And the reason that people like to lean forward on the cart, or they feel like they'll say it takes the pressure off of my back, is it works like this. Okay, so what was this called? Oh, more of that time. Good. So this herniation, most common level is L4, L5, which is right here. What's the most common level for arthritis? L4, L5. How about that? And another thing that you should realize is like when you see two numbers, like on an X-ray or MRI, where it's like L4 and L5, it's really only one level. So they name this disc level by the vertebrae that are around it. So L4, L5 is only one level. Okay? Does that make sense?
Yeah.
All right. So bone, and then what's this right here? Disc. Right. Spinal cord, and then you have nerve roots coming out the back. So is anybody taller in the room, taller right now than when they were 18? All right. Okay. So, what was that?
It's smart out.
My mom says the same thing, so you're okay. So what happens is as we age, the space between the bones in our back gets shorter. This is the number one reason we shrink as we age. Like I used to be 6'3", and now I'm 5'8". All right. So, but yeah. So as we age, we lose space between the bones in our back. Yeah.
Does everybody, is this a part of life, everybody shrinks a little?
Everybody that I know. Yep. To some degree. It's even daily. So, like, there's a little cycle on a daily basis. When you wake up if you sleep at night, when you wake up in the morning, the space fills back up with fluid. So you're taller in the morning than you are at night. And most people will fluctuate up to ½ an inch every day. But as we experience life and become more and more seasoned, we lose that space. So L4, L5, just to go along with that, it's not only the losing of the space, you can also have a breakdown in posture, which will affect height as well. There's a really fascinating study. Here, if anybody like to read? There's what was the name of that book? A guy did a research, it's called Blue Zones. And this researcher went around the world and studied 5 groups of people, and you can even go online, I forget what his name was, but you can go online and watch videos on this. But he studied groups of people that have like really long life expectancies. And when they go, so like one was Okinawa, Japan, Sardinia, Italy. There was somewhere in like Argentina or Chile. There was somewhere La Jolla, California. There's a group of Seventh-day Adventists that are really, really active. That by no means is a religious comment, but it's very true, like just their activity level. They x-ray people. They all have arthritis and stenosis. They're just not affected by it. So they're like really, really active. And they show videos of like people that are 90 years. So in La Jolla, California, there was a surgeon who was in his 90s still working. And he looked amazing. Same exact thing for the other countries. They'll pull these case studies of people that are active into their 90s and even beyond 100. It's called Blue Zones. But there's really fascinating studies on, like, this happens, but it doesn't necessarily have to stop you from living. Like, these people are active, they're pain-free, it's not affecting them at all, but it's still happening. All right? So this person, what happens right here is when that space shrinks down, that action is called degenerative disc disease. And then what happens is back here there's a hole. Anybody know what that hole's called? It's called a foramen. I'll never ask you to repeat that again. So there's a hole, and that's where the nerve comes out. But what happens is as those bones get closer together, that space shrinks down. So this person, when they stand up, what happens? Hole shrinks down. When they bend forward, lean on the cart, or when they sit down, hole opens up. Okay? Does that make sense? So standing up, closes down, lean forward, opens up. All right? Yeah, this one, so if you took 100 people in the U.S. with or without back pain and gave them an x-ray, what percentage of the population has signs of this? It's 95%. So it's extremely common. Getting back to your point about does this happen to everybody? Well, 19 out of 20 people it happens to at 50. Okay, so it's really, really common to see. Now the tricky part with this is frequently we'll see somebody with this in a history and they're not getting better. And what can happen is you can actually have two causes going on. So we'll see somebody, much like Carol said, I've tried other physical therapy, or they'll say I've tried everything. So I've done injections, I've tried heat, I tried ice, I did acupuncture, I did I bought an inversion table at Costco and I laid upside down. I've done everything. And usually what they're doing is they're pounding away at this cause, and little or no change. Whenever we see that, there's always an underlying problem, and it's the next thing that we're going to talk about here. So if we have a stack of blocks, what's the most important block? Bottom block. Why? Yes, right. It's the foundation. So if we move this, everything else moves. Because gravity works like this. If we move this, it just affects the top block. Okay? So we do a little trickery here. Tailbone, pelvis, L5, L4, L3, L2 on up. And this would be like looking at a person from the front. Okay? Pelvic ring there. And this right here is would be the right flank or the right hip, left hip over here. So, what's that called right there? Called it the sciatic before.
Oh.
I didn't mean to put you on the spot.
That's okay.
All right. It's called the Sacroiliac Joint, or SI joint. So problem number 3 that we're going to cover, the most overlooked one, is an SI joint or pelvic problem. I cheated Carol. When you came up, you told me your history, double laminectomy, that history, still having trouble, still not feeling okay. I know to look for this right away. It's so overlooked. Patriot News did a really good story. We saw probably the most emotional case ever that I've seen. And this one threw me off a little bit, but we had, and this was over on Prince Street, a lady come in. She had a 6-year history of really bad pain. She was 35 years old, and I found this out later, but she had paid over $10,000 out-of-pocket expenses because she had a high deductible over the course of 6 years trying to figure out what was going on. And what she would have is, after the birth of her 3rd child, she started developing severe pelvic pain. So pain in the groin, pain right here, pain in the buttocks. It eventually started traveling down into her legs, and it got so bad that she actually lost control of her bladder. So really, really common when we see, and usually people won't report it to us in the beginning, because there's a lot of embarrassment with leakage, but and it happens equally in both men and women. But like we'll start treating this, and the person will come in and say, "Oh my gosh, like I don't have any more leakage. What happened?" Well, there's muscles in your pelvis that control your bowel and bladder, and if they're stretched out or they're not moving the way that they're supposed to, and they're weakened, then you lose control. When this starts moving again the way that it's supposed to, just by what we did with Carol right here, everything changes. So she retired now, but we had a back pain and pelvic floor specialist that did only this. And this lady came in for her first appointment, and the therapist picked it up and said, "Hey, like I think you have something orthopedically going on, or osteopathically in your pelvis. Let me call Chad in." So I went into the room. I asked her what was going on. She couldn't squat. Like literally, she couldn't bend down or she would lose control. She couldn't lunge or anything like that. I did almost the same exact thing that I did for Carol with one little variance. And she hopped up off the table and she started crying. And I was like, well, I thought I did something, like I thought I broke her or something like that. And she stood up and started squatting and did a lunge. And she was like, "Oh my gosh," and all this time. So here's a 35-year-old mother of 3 who really completely lost her life and got it back. We saw her for 4 visits. She got complete control of her bladder back. Patriot News did a story on that. I think you can find that in like 2011 or 2012. And it was, I think she spent like less than $200 in care with us, and she had paid over $10,000 previously. And it was all because everybody that she went to missed the calls. Okay? Very, very common. So disc herniations, 35 years of age and younger. Stenosis, herniated disc, 35 years of age and younger. Disc degeneration, arthritis, stenosis, 50 years of age and older. What's the age right here? Yeah, that's the tricky part. We've seen as young as 15, and then we had a ballroom dancing instructor who was 96 years old, and this is what she had going on. So she went out and taught other seniors how to ballroom dance. She was fascinating. And probably my another favorite story is we saw this guy. He was in his early 80s. 50 years ago, he fell off a 4-story roof. He was a builder here locally in the area. He was braced for years. One day he just tore the brace off and he decided to live with it. Well, you can imagine if this goes unaddressed for years, bad stuff happens. And he had fractures all up and down his spine. And day when we saw him, he couldn't walk 20 feet from the waiting room with a walker back to the treatment area. And 4 weeks later, he walked a mile. He now travels by RV all over the country. He has a little Chihuahua that he travels with. And the whole deal is for 50 years, nobody ever addressed this when he got treated. We just got that to move, and then he was fine. Really, really neat, got his life back. So how this works frequently is not only will the person have like pain by their tailbone off to one side, and again, this is what a lot of people will say, my sciatic is bothering me. But also you can get pain in the groin, pain in the buttocks. When we see people with this, sometimes they'll say that like one leg feels heavier than the other. So, or it's also the person that, who said getting in and out of the car? Yeah, like almost every time that we see people have pain getting in and out of the car, where they have to like position themselves the exact way before they get in and out, they have this going on. All right, so really, really common. This also affects a lot of runners. I know we had one runner. At least, very big, very important part. This has to move for you to be able to run. Okay. Any questions on that? Are you sure?
So manipulating what you were doing to her is doing what to that?
Okay, so next thing we're going to talk about is successful treatment for most cases. So we talked about cause and the 3 causes. By the way, is there anybody in the room that this isn't fitting into? Okay, all right. And you can see me after if you just didn't want to raise your hand right now, but let me know. Because many times we'll, like, if you're not identifying with one of these, that's the person that needs like an X-ray or MRI like right now. All right. So we're addressing the cause, and we want to know what successful treatment looks like. Remember how I said like 10 years ago I was kind of like attacked a little bit by other therapists when we started doing this? It's actually it's a national requirement now that universities that offer doctor of physical therapy programs that they teach this treatment technique. Because, yeah, it's so weird. This is a horrible story. I was helping teach a course on manual therapy, or you said manipulation. In Pennsylvania, we're not allowed to use manipulation. That's okay. They call it a grade 5 mobilization. Guess what? It's the same exact thing. It's semantics. It's how we say stuff. So anyhow, I was at a local university. I'm teaching the course. We have a license to do this. And I stood up and I said, by the way, our therapists that do manual therapy, like I'm looking at the numbers, their people get a lot better. It's not 25, 25, 50. It's like 90, 10. Like 90% of the people are really, really happy and do well. So it's better numbers. People get better. They're happier. They refer other people. Like, go this route. Like, you get much better results. And like, we almost got in a fist fight where this group of other therapists came up and they said, this is horrible. And in the end, on a national level, like, we finally recognized that this is the way to go. The roots are in Europe. So most countries in Europe have social medicine. So you can go down the street to the free clinic where you usually don't get this, or you can do a cash pay out of your own pocket. And what happened was European physical therapists, they were under stress. So like, when I'm up here without a net, at the last second I find out you had 2 laminectomies, but they have to produce a result. And what they found is that there are 3 things that can produce an immediate result because they address the cause. And those 3 things are hands-on, physical therapy. Okay. And at least the way that I learned it, the guy that I studied from, the roots are in osteopathic hands-on therapy. So it's actually osteopathic based. And there's a fascinating story that goes the whole way back to World War II. But basically, with hands-on physical therapy, we're getting the pelvis to move. So when Carol was up here and I was just giving her leg pressure, so the first thing I did, you could see like I was just giving her leg pressure through her pelvis, getting that to move. And then where she was pressing up into me, she's just firing her muscles in a pattern that get her pelvis to move. Okay? So that's the first thing we're doing, hands-on physical therapy to get normal movement there. The second part of that, so you said manipulation. When you think of a chiropractor, what do you think of? Manipulation, right, like back cracking, and that's fine. But if you do this and you don't do anything else, you end up doing like a manipulation roller coaster. So you feel really bad, and you get manipulated, then you feel better. And then a month later, you feel bad again, then you go get manipulated again. You just keep doing that. We've seen people that have done that for 40 years. And I don't know why, but that happens. And the whole time, they could have saved themselves a lot of time just by adding this second component. And so when you think of back exercises, or when you think of physical therapists, what do you think of? Exercise. And when you think of exercises, most, at least doctors in this area, will go stretches. But if we break it down, most people really have a weakness issue. It's not a stretching issue, okay? So when we see people in physical therapy, we'll do a couple stretches, but the thing that we really do is strengthen. Okay, and they're very light. You don't have to stand on one leg and do any crazy movements or anything like that. You can get there depending on how active you want to be, but it's strengthening exercises are the way to go. And what you end up doing is you re-educate the muscle, you retrain the muscle, so that you don't need this over and over and over again. The goal isn't that you have this forever. The goal is that you have this for a month, 2 months. If you've had years of pain, it might take 3 months. But you don't need this forever. So it's hands-on PT to get normal movement, and then strengthening exercise to retrain the muscle. Have you ever heard muscle has memory? Okay, so really bad example. See how crooked my bottom teeth are? I used to have braces. I didn't wear my retainer. I wasn't good at that, so the muscle memory in my gums took my teeth crooked to the way they used to be. It's the same exact thing with your body. Okay, and if you've had back pain for more than a year, it's probably going to take more than one time doing an exercise to retrain the muscle. But you want to move and then retrain. And then a couple people will need, there's one more thing. So in our clinic, like if you look here, I mean, it's pretty much tables, a couple small pieces of equipment, but almost everything that we do exercise-wise is designed so that you can do it at home. Okay, so that's really easy. But it's the reason we can do this is because all of our therapists or doctors of physical therapy, they're trained in hands-on technique. They've all done, it's pretty rigorous to get a position here. But anyhow, they do hands-on PT, followed up by exercise. We don't do a lot of electric stim. Like most of our therapists have never done it in their life. We don't do a lot of ultrasound. Same thing, like it's just not needed. Hot packs, stuff like that. In the research, it doesn't really address the cause. It can make you feel better temporarily. So remember that number 2, second way you can handle it was like alter or change it. Like you can feel better for a little bit, but if you really want to address the cause long term and maintain independence or get back to living your life, get back to being normal again, the way to do it is hands-on PT, strengthening exercise, and occasionally we'll do traction. And the reason I say that now is because there are stenosis cases that do really well with traction. Okay? And do you know what traction is? Or the other way that they'll say it is decompression. Like we have a decompression table. You can go locally and sign up for 20 treatments on the same decompression table we have, and it's $3,000 out-of-pocket cash. You can come here, and your insurance company pays us $15 to do the same thing. Yeah, it's a word trickery, but it's traction. It's the same mechanical benefit as traction. Or like, has anybody ever used an inversion table where they lay back? Same mechanical effect there. So any questions on that? I believe we are through your sheet. The thing that we at first, are there any questions? Did you get your money's worth? So the thing that we always do is if you filled out your sheet and you want, so we don't offer free screens to the public, but for people that come to a workshop and you fill out your worksheet, if you want a free screening with one of our back pain and sciatica specialists, we'll offer a free exam today. Now, what's been happening to us is because these are growing, it's really tough to schedule 25 people at the same time or whatever. We have 30. So I have a little sheet, and you can take a sheet if you want to do like an express checkout, like you're at the Holiday Inn Express, and you can just write your name, your phone number on, and I'll pass these out. And the best phone number to reach you at if you want to take us up on this. And then what you'll do is you'll get an appointment with a physical therapist. They'll go through, they'll do testing. By the way, what I did with Carol here was like the express version. But they'll go through more testing, see exactly what the cause of your pain is, and then show you what successful treatment looks like. All right? I'll pass those around. Yep.
Does your insurance pay something?
Does the insurance pay? So how many people are Medicare? Okay, so yeah, so we have Medicare. We work with, in any given year, we see referrals from over 200 doctors in our area. So just about every doctor knows us. The new thing is, this is crazy, but within the hospital systems, we can't communicate with those doctors as well as we used to be able to. But we'll still get phone calls from them asking about cases. So Medicare covers 80%, and then if you have a secondary, that'll pick up the additional 20%. But we participate with Medicare, Senior Blue, Highmark, Blue Cross, Health America, Aetna, everybody. Freedom Blue, yep, Freedom Blue, we do everybody. Yep. Oh, you have to ask on that one because there's a couple different plans. Everybody that we can participate with, we do. All right, I know there's a Guy Singer that we couldn't get on with Guy Singer because they had a fight with Hershey and they moved out of the area. Now they're moving back in. Yeah, everybody that we can do. Yeah. Good question. With Medicare, what we can do is we can so after the free screening, there's an official evaluation that has to be done for Medicare, where we do some other testing as well. We can do that testing, and it will run through Medicare. We just can't treat you. So what happens is we do a report on that day. We fax it to the doctor. The doctor signs the report and sends it back. And by the way, it's like 99% of all doctors do this, unless they want to be a stick in the mud with us. And then we just hand you the phone and you call the doctor and they sign it. But then you're covered. That's a prescription, and then Medicare covers everything for you.
Is that if you need a referral?
That's if you need a referral. Yep. The other thing is we have therapists that are direct access. So if you're not Medicare, we can evaluate and treat you without a physician's referral, and your insurance covers it. Yes.
You do have physical therapy assistants in addition to your physical therapist?
Well, let me guess where you're going with that. You see the same physical therapist every time you come in, unless somebody's away on vacation, or like we just had, actually the therapist on the wall within the last month moved to Maryland. So obviously that changed our dynamics a little bit. But every time you come in, you see the same physical therapist and the same physical therapy assistant. By law, what can happen is the physical therapist should be doing the assessment and the hands-on and making sure you're progressing well. They work with the PTA, the physical therapy assistant, also a licensed physician, to create an exercise program, and the physical therapy assistant walks you through that program. All right? And then
In some places, the physical therapist works up the whole thing, and then the assistant takes care of you each time you go.
Right, and that's every day you come in, you will see the physical therapist, and it will be the same one. You schedule out with the same people. I used to work at other places locally, and that was something that bothered me. Is like I would grab a chart, and now I had to like either remember what happened 2 weeks ago or 4 weeks ago, and like there was a disconnect. So what a lot of people like, and I think one of the main reasons that we're popular is they see the same physical therapist every time, so they don't have to completely rehash their story. Yep.
Thank you.
Yep. Any other questions? Yeah.
If you're all done asking questions, before you disband, it's very important for us to know how you received your invitation for your workshop. So next month when we invite people, we use the right medium to get their attention and let them know about this wonderful service that Man Physical Therapy is providing. So when I call your name, if you can just tell me if you got your invite through the Paxton Herald, or you saw it in the guide, or if you received a postcard.
Is there any way we can do it by show of hands?
Well, I don't know every face.
Okay, well,
It'll only take a minute.
Okay, all right.
Honest,
Okay.
it will. Okay. Okay, Joan,
Paxton Herald.
thank you. The Reeses,
Paxton Herald.
okay, great. The Dietzes,
Paxton Herald.
oh, I see a really good,
It's hot.
yeah. How about Bonnie?
Paxton Herald.
All right.
I sense a theme.
The Sheetses,
Paxton Herald.
whoa. All right. Beverly,
Paxton Herald.
easy. Jean,
The guide.
okay. How about Arlene?
I think it was the guide.
Okay. And Jim?
Paxton Herald.
Okay. Mike?
Postcard.
All right, good. At least somebody got one of those. How about the McClintocks? Okay. And Dolores.
Paxton Harold.
Thank you. Carol?
I'm new to the area, so I'm not sure. It was a paper.
Oh,
I'm not sure
okay.
which one.
All right. No, wasn't sure. Okay. How about the Zimmermans?
Paxton Harold.
All right.
Wow.
Nancy?
Paxton Harold.
And Vince?
Paxton Harold.
Wow, Paxton Harold wins. How about it? I guess we better invite everybody through that same medium next month. Thank you. Thank
Yeah,
you
that,
very
that
much
is such a
for your
big help
time.
for us, just so
Yeah.
we know where to go to. Yeah, we'll be in the Paxton Herald for a while.
Yes, we will.
So thank you, everybody. We do have there are receptionists out front if you want to schedule now and you have time.
And I will be out there to collect the express forms, okay?
Yeah.
Thank you so much.
Betcha.
You're very welcome.
Thank you very much.
Thank you. You're dismissed. How's it going? Good. Yep. Very rare. Scoliosis is curvature of the spine. 15 feet versus Okay.
Similar to what we had with 15.
Okay. What's he have pain doing?
Details.
That
I
was
know he does certain exercises.
grab a copy of the book.
Yeah.
And get him one of those. And then, is he local here or is he outside the area? Okay. Next time he
But
visits.
anyway, thank you very
Yeah,
much.
yeah, you're welcome.
Hi.
One of each.
Yep. Okay.
Yes.
Yeah, you'll know right away. I mean, yeah, how long have you been in trouble? Okay. Yeah, has anybody, has anybody ever done a hands-on? Like we did on the same letter? That's your key, like, just see the report. That would be, like that's the quick and easy way to go, is see how you feel after one visit. Like many times when I hear stories like you're sharing with, it's like I have everything wrong when I tried it. I'm doing shots, but I got stuck as well. I just sprint that outside and help the problem. So what happens is like when you have that SI joint help the problem, and you have bulging disc or stenosis on above it. Yep. So what happens is a problem here is more pressure. If you solve this by going hands-on, this will. I don't know of any chiropractors, and I know one in Kentucky that will, Paducah, Kentucky, that does the hands-on PT that we do here. I don't know any most chiropractors treat the spine higher up. They don't treat the belt. Yeah, my guess is you have an underlying cause in the pelvis. So you get that to move. But I can't tell you what he or she do. But yeah, most people when we see them say, never did ever do that before. Wow, I feel a lot better. Just like All right. Thanks.
I had a question. I've been, I had herniated disc issues since 1990 when I had a flare up in
got me on doing that, Mackenzie.
Yeah.
So I do that, but it's, I guess it's helping the spine, but it's still not helping the bottom. That down where Carol had.
When I showed the circle where 50% of people were just okay, 25% were happy, 25% were worse, that was Mackenzie therapist. The type of therapy that we do now, the hands-on will address that directly and get it to move.
Is it Mackenzie making it, I do it every day, is it making it worse?
So you're doing prone press-ups?
Yeah.
Probably, I would say that's not, likely not something that you need to do or something that would help you. It could aggravate. Yeah, especially if your pelvis isn't moving the way that it's supposed to, and then you're just trying to move it over and over again, being forced through there, that can create some problems.
Because I even have a Mackenzie where if you have pain in one side, to shift your hip.
Yeah. Oh yeah, side glide. Yep.
I was doing that.
Yeah.
And it seemed to help a little.
So it gave you like temporary relief?
Yeah.
Yep. And that could be. You're still opening up that space, but you're not getting the pelvis to move.
But it's right here.
Yep. Yeah. You're lower than L4 is right here,
Yeah, my,
and you're right there.
oh yeah, right there.
Yep. That's that third problem that we talked about, the Sacroiliac Joint. Get that to move. Yeah.
So if I, then once you go through how long it takes here, then you have exercises to continue.
You got it. You get those day one. You start building the program day one, and it gets more and more exciting as you go. Yeah.
Would you just do that the rest of your life?
Most people get into a walking program when they graduate, and they just stick with 3 or 4 basic exercises that they do once in a while. Yeah.
Okay. Thank you. It's been years, so I'm trying to find help.
Okay. Hi, Jamie. How you doing? Haven't seen you in about 10 years. Yeah. Congratulations for you just got married.
Oh yeah.
That's great.
Thank you.
Yeah, I was talking with your mom, and yeah, she said she was from Middletown. I said, and then she said 38-year-old. I was like, 38-year-old. What's her? And I was like, McClintock, Jamie. And then, small world.
I'm still Jamie McClintock, so even though I'm married.
Oh, is that right? You kept your name?
Yeah, I'm
All
still
right.
here. Yeah.
Cool.
So
That's
I'm
great.
still the same. You've done great. I love this place. I don't want to hold you up because I know that there are people here with questions, but I think I'm probably going to end up trying to come in
Okay.
do some things for my, I think it's my SI joint.
Yep. And
I'm pretty positive.
okay.
And I just didn't, my other physical therapy program was not helpful at the other place, because I think they're doing a lot of the electric stim and, heating and cooling and some exercises, but nothing that was super helpful, so.
Do the hands-on.
Yeah.
How are you
I
feeling?
mean, they
after
did, but they did it different
Good.
than what you did here.
Yeah.
And I think what you did here would be a lot better for me.
Yeah.
Because what they did was more like direct on the injury, and it was very painful, so.
Like almost trying to massage the SI joint. Yeah. That,
And it just made it worse. It was like scary.
This was
So I
really-
stopped going, and
really
now it's been
interesting.
like since October, and I still like
Yeah.
can't run or do anything.
we'll see you soon.
So you'll probably see me.
Yeah, we'll be here. You're, do you have like tough work hours?
Kind of. Like I probably wouldn't be able to get here before 5:30 during the week. So
We go till 7.
okay.
So,
So yeah, it would be feasible.
Yep.
Be feasible for me during the week.
Yep.
Yeah.
cool.
So it was great.
Well, great to see you.
You look
Yeah.
great.
Yeah,
This place
thanks.
is awesome. I'm so excited
Thanks.
for you.
Yeah.
I'm like, what have I been doing with myself? Can I have
Yeah,
something?
don't do that. Yeah. Great to see you.
Thank you.
Okay,
Very,
take care. I'll see you
very
soon.
interesting.
Thank you.
I'm sure I'll see you soon.
How you doing?
Bye-bye.
My wife wants to talk to you. She had to go to the rescue.
Okay. Is she out front?
She went out that way.
Yeah.
Now, he said 2 weeks ago, I went to my food, and I told him about my back. He did my knees for me. And I said, what's the trouble with my back? No, it ain't. No. Get up on the table. Got up on the table, and hit me right on the leg here. I come off it did, but a couple
In your hip. But you have back pain too?
right? And I'm gonna give you a shot.
Yeah.
Give you a shot, put it away. Back here.
Yeah, so usually what happens is, when you get pain in your back, where does it hurt? Like right on your tailbone?
Right here.
Yep. And that went away when he gave you an injection in your hip. Okay.
Now, I'm old fashioned.
Yeah.
I use horse radium.
Yeah, we see that all the time.
And it worked. From my pain in my middle knee, the pain goes away and back.
But that's temporary, right? You rub horse liniment every day,
Not every day, no.
a couple days a week.
Mm-hmm.
Yeah. So what that does is there's a drug in there that alters the way that you feel. So like if you're getting nerve pressure where you're feeling pain, and then you use the horse liniment, it changes the signal that you receive in your brain. So you think you're okay, but there's still a leak in the roof, just like we did here, like that leaky tile. It's that same idea. But yeah, we see it.
Back when I was working, I was working on the high line, the high power line. It's 60 and 70, 80 foot pole. And my buddy was up on the top, and we were coming down. And he went and tied that over the timber, safety it off. I told him, okay. So he starts down and went to get over the timber, and he fell backwards. And made a somersault. He came down and his hook hit my head.
He hit your head. He fell on your head.
Hit my head, one hook. The other hook came straight down through my leg. Never touched me. The one that slid off of my head, he caught my second shirt. I had two shirts on. He split the shirt right down to my waist. And he laid me up for about 6 months. I had to go to a chiropractor.
How long ago was that?
Back when I was 37.
So like 3 years ago? 3 years ago?
Yeah. I'll be 90 this year.
Is that right? Well, you're moving pretty good. What's your first name?
Harry,
Harry. Nice to meet you, Harry. I'm Chad.
guess my wife and I were the oldest ones here.
You think so?
Yes, sir.
Okay. Could be.
She
I had an uncle who just turned 90 here locally, Al Seitz. You know,
She's 89, I'm 89.
how many years you been married?
68.
Wow. That's a lot of years. You put your time in, Harry. Let's walk out front here and see if she's out front.
She went out to the restroom.
Okay.
get rid of the chairs first, don't we? All of them came out from out here.
I think we did 1, 2, 3, 4, 5, 6.
5 stay here, or 6?
Thanks, yeah.
Okay, well then we'll leave those in the back there. Got my first 20 miler in this morning.
How'd that go?
Good.
How long are you riding? 100?
Yep. I've had 3 patients give me donations so far.
That's pretty good.
Yeah, Bill Toner gave me $100.
Wow.
Yeah. Life is good, baby.
What's your date?
October 3rd.
Okay.
Yeah, I'll get them. Those 4 stay in here.